At Women's College Hospital, in partnership with Ontario Women's Directorate, we developed an online curriculum for healthcare providers around issues of domestic violence or woman abuse. The curriculum that we developed is online, interactive, and uses a video gaming format. The content of the curriculum is derived from the best evidence in the research literature, as well as the experience of expert panel members. It's a competency-based curriculum, which means that learners progress from the most basic competencies through to more subtle, advanced states of learning. The 17 different scenarios now comprise 3 different volumes. One dedicated to those who work in emergency department settings in hospitals, one to family practice in or not in hospital settings, and one to those who work with pregnant or postpartum women. The training has reached more than 3,000 participants. 3,000 individuals have actually registered, completed the demographic form and the pre-test. And we have introduced the training to probably another 1,000 individuals through conference presentations, posters at conferences, grand rounds in hospitals, using the Ontario Telemedicine Network, where 35 hospitals signed in and brought individuals to access the introductory session of the training program. Those who have completed the training almost unilaterally say that they have learnt more about the issues, feel more competent in addressing the issues, in helping their patients and providing needed and necessary resources to them. In fact, 98% of those who have participated in the training say that they will change the way they practice medicine as a result of participation. Our training is structured around discrete units of learning and around particular competencies or skills. I think that designing a curriculum to meet these standards of skills helps both to focus the education in the training and to provide learners with a sense of what direction that training is taking. I think that the competency-based curriculum, grounded as it is in the best evidence from research and from expert opinion, also lends credibility to what it is that we are teaching and makes it easier to sell as a curriculum within hospital settings, certainly to healthcare providers. We know that women access the healthcare system as one of the early entry points into meeting with professionals who could provide them with help around their issues of violence or abuse. If the healthcare providers aren't aware of indicators, risk factors, presentations, and some of the complications that women who are experiencing violence face in their everyday lives, along with those healthcare conditions that first bring them to a practitioner's office, they're not going to be able to intervene, interrupt the cycles of violence, to get needed resources to women early in their experience, to help them make decisions about what they want to do and what they want to do now and what they might want to do in the future. The better trained our healthcare providers are, the better able we are to get help to women at times when they need it most critically, and in a supportive environment that they're familiar with, and from a professional whom they generally trust and respect. So one of the strategies that we are now moving to is to introduce the curriculum into medical education instead of introducing it at the continuing medical education level. So we are in conversation with a number of different deans and medical schools and nursing schools to look for ways to provide access to them and their students to the online curriculum so that there's less unlearning required later on in practice settings. The other thing that we have done is we've had the support of our hospital, Women's College Hospital, which has now taken the curriculum and made it a core part of expected learning of every healthcare provider and every staff member within the hospital as an organization. And I think that this is going to contribute to the sustainability of the online program as they will provide the funds to keep it online. Finally, as an online program, we face fewer of the costs required to get out and provide the training. It's accessible to learners 24/7 on their own time from their own home computers. It doesn't necessarily require that they take time from busy practice days in a hospital. It can be done at home in your pajamas. And so I think that that also lends to the sustainability of this particular curriculum and project.